Dr. Kate Tulenko joins us now from insight into the Mpox spread. She is the founder and CEO of Corvus Health. Kate, thank you so much for joining our program again today.
It's a pleasure.
Kate, I want to ask you, first of all, why are we seeing this new strain of Mpox suddenly emerge?
There's a viral reservoir in animals in Africa, and so it's always there. And if people capture and eat those animals, or get scratched by those animals, they'll get Mpox. And also, especially in the Democratic Republic of Congo, there's war in the western part. Also, there's a lot of poverty, so there's a lot of commercial sex work. So it's sort of the perfect storm for this disease to crop up again and again and again. And because it's so difficult for people to access health care, the Mpox isn't diagnosed as quickly, so they don't isolate. The ring vaccination can occur. And so that's why you see it constantly cropping up in this area.
One of the health experts in Jim's piece right before you says that this strain is much more dangerous and much more concerning. What's your take on it? How worried should we be, particularly as we have seen this disease spread beyond Africa's borders in Pakistan and Sweden?
Yes, so it's both more contagious and also more deadly than the previous versions of Mpox. I think the vast majority of your listeners have no reason to be concerned. But if you do have a problem with your immune system, or live with someone with a compromised immune system, or if you travel to Africa or are a man who has sex with man, I would recommend getting the Mpox vaccination. As far as everyone else, I would recommend, refilling your hand sanitizer, making sure the kids go to school with hand sanitizer, on their backpacks, and just working on that hand hygiene, because that's how the vast majority of people are going to protect themselves.
I want to talk about the vaccines. A Danish firm, Bavarian Nordic, is one of the few companies that actually has an Mpox vaccine. It says it plans to ramp up production and could already supply up to 2 million doses this year. Put that number in perspective. Is that really enough for the demand, and how quickly will it get to those most at risk in Africa?
It's definitely not enough for the demand. It definitely is enough for ring vaccination. So when they find a case, they can vaccinate everyone who had contact with them, everyone in their community. But as far as most people who will want to have it, there's not enough. In fact, I've been wondering for myself. I had the smallpox vaccine, 50 years ago. I'm going to Africa next month. I'm going to see if I can get vaccinated, but there might not be the supplies for that.
That's very worrying. Well, Mpox is, of course, different from COVID-19, but in your opinion, what lessons did we learn from the COVID pandemic that we can apply in this case, both from the standpoint of governments and health agencies, the professional institutions, but also from the approach of the general public?
I think the most important lesson learned was acting early, and that's what WHO has done now by calling it, a global health emergency. And this is the third emergency in 5 years: one COVID, two Mpox. So calling an emergency triggers funds being released. It also triggers certain restrictions. And I think the second thing that was learned was the importance of communications, frequent, clear communications, and also the importance of reaching out to communities. Many communities, now have doubts about science, or there's certain communities, for example, in Africa, that might be in hiding, either because they're combatants, or, as I mentioned, they're commercial sex workers. And the government needs to have protected communication with those groups in order to educate them, in order to vaccinate them and screen them. I also think that, because of what happened with COVID, we're going to see more screening in airports, where they screen just for temperature, with the scanners. I'm sure you've seen the photos of your temperature from red to blue and green. Also, a lot more asking where you were when you come back home. In Africa, we're going to soon see restrictions traveling between countries, or only allowing people who've been vaccinated to travel.
It's the world we live in, isn't it?
Yes,
there are 2 known strains, right, of Mpox right now. But do you think other strains could emerge and become even more transmissible and dangerous, as we saw, some of these other strains of COVID? Is that just kind of the natural cycle of viruses?
Absolutely, that's the concern, and that's why we have to take it seriously. Even though people say, well, 5%, I'm willing to take my risk. You never know. It might combine with another type of virus. It can evolve. It can mutate. So we have to take every outbreak of every infectious disease seriously because of that.
All right, Dr. Kate Tulenko with Corvus Health, thank you so much. Always a pleasure.